in the comments a video that our social video director, Nico Pitney, recorded explaining some of the early warning signs that President Trump appears to have ignored that could have allowed him to respond sooner to this crisis. Since he recorded that video, we have learned new things. The Washington Post reported this week that on more than a dozen occasions in January and February, the president's intelligence advisors put alerts, put warnings about the virus in his presidential daily briefing, and he appears to have disregarded those. It has often been reported that the president does not read his daily briefings. In fact, it has been speculated that he seldom reads at all. Samantha Bee has even postulated that he is incapable of reading. He can read. We have seen him read. He's likely going to read from some prepared remarks when he comes out today. And I will tee up in advance. He is likely to be very conciliatory in his prepared remarks. He's likely to salute the governors of both parties for their great work in protecting people in their states. He is likely to call for this whole nation to work together. And then when he leaves his scripted remarks, he is likely to lash out, attack Democratic governors, attack Democrats. That seems to be his MO. Now, again, while we are waiting, we are expecting the President of the United States at any moment. The briefings in recent days have been more economic focused than medically focused. Today's a bad day to have to focus on the economy. The most recent numbers that came out today show that in the past 6 weeks, over 30 million Americans have filed for first-time unemployment, and consumer spending has decreased by over 7%. This is the largest decrease over a month's period in 60 years. Now, again, I am Alan Piper. If you care to follow me on Twitter, I am apiper13, and I am supported by our NowThis team, everyone working from home. I am broadcasting to you from my apartment in the East Village, where it is very likely that a cat will jump up and mess with my camera, and I could lose you for a minute because of a cat. Now, we do see that Dr. Birx is in the East Room where this briefing will take place. I hope that she will be allowed to speak. Her time is very valuable, and she is one of the top medical advisors dealing with this crisis. On a number of occasions recently, she has been present for lengthy briefings and has not been given an opportunity to speak, and one might think that her time could be better used. We're going to try to use this time well while we are waiting for the president, so please type your questions in the comments, and my team and I will do our best to answer them. Now, while we're waiting, I mentioned that timeline while we're waiting for the president to come out. Hold on, we're just going to check the sound. Okay, good. We are still getting an audio signal. While we are waiting for the president to come out, I will again run through a little bit of this timeline because the president keeps trying to recreate it. He keeps trying to suggest that the problems that our country is encountering now are the work of previous administrations and that there's nothing that he could have done to better prepare for this. And that's just not borne out by the facts. So the facts are, you're going to all have these memorized too, because I read these most days. So let's focus on the facts. 2014, President Obama formed the Global Health Security Unit within the National Security Council, and President Trump later fired this group of people. All right, we have our first question. Sophie asks, when is unemployment money going to run out? The current expansion of unemployments by, well, there's a couple things there. So you may be referring to two different things. There is, on top of regular unemployment, the CARES Act grants an additional $600, and that is scheduled to continue until July 31st. After that, it will expire unless it is renewed by Congress, which could prove challenging because Mitch McConnell has expressed great reluctance to pass further economic relief. So, 2014, Barack Obama and Joe Biden and the Obama-Biden administration put together a global health security unit within the National Security Council. It is their job to be on the lookout for emerging public health crises. They also put together a 69-page pandemic response playbook so that whoever the next administration is, they don't have to start from scratch, they don't have to reinvent the wheel, they get a step-by-step instruction of, you see this happen, here's what you do to immediately swing into action. Now, in 2017, during the transition period, at the beginning of the year, Obama's National Security Advisor Susan Rice says that she specifically warned Trump's security team that a pandemic was one of the biggest threats that the nation could face, and she made sure that they received that 69-page pandemic response playbook. You know how it is when someone asks you for advice and you give them really good advice and then they ignore it? That must be how the Obama team felt when President Trump's team clearly cast aside this carefully constructed pandemic response playbook. Now, also in 2017, we know from reporting from The Nation that the Pentagon flagged to President Trump that there could be a potential shortage of masks, hospital beds, ventilators, and other equipment that would be needed should the U.S. face a national health emergency. Now, President Trump likes to use the phrase that the cupboard was bare. He has been in office for 3 years. He has had 3 years to fill up these national stockpiles. His own Pentagon was urging him to do so in 2017, and the president did not take advantage of that time to prepare for a threat that had yet to emerge. All right, we have a question from Julie. What happened to the seasonal flu? Where are the seasonal flu deaths? The answer is that from 2018 to 2019, about 34,000 people died from the flu, according to the CDC. Now, it's important to note that that is over a 1-year period, and we are looking at 61,000 deaths over roughly a 6-week period. This disease is much deadlier than the flu. Where medical health experts are still figuring out the details of this disease, but it appears to be about 40 times as deadly as the flu. Also, Dr. Redfield of the CDC has specifically warned that we could be looking at a very grim scenario in the fall if coronavirus is still with us, as he and Dr. Birx and Dr. Fauci and other public health officials have said is likely, and we have regular flu on top of the coronavirus. Now, Kim asks, do you know if the virus can be transmitted via a swimming pool? Would chlorine or salt water be better? The CDC says, quote, there is no evidence that the virus that causes COVID-19 can be spread to people through water in pools, hot tubs, spas, or water play areas. But it is important to note that it can easily be spread from person to person. So if you're going to go be in a hot tub with someone, that's not good social distancing. Now, speaking of good social distancing and public health guidance, I see that some of the people in the East Room are wearing masks. This is a refreshing change. It has been notable that these briefings, the White House has not been abiding by the same directions that it applies to other people. The White House has been saying don't collect more than 10 people in a room together, and it has been repeatedly collecting more than 10 people in a room together. It has been saying please stand at least 6 feet away from other people, and the coronavirus task force has often been standing individual members standing inches away from each other behind the podium. The CDC has urged people to wear masks. The President of the United States has specifically said that he would not wear a mask. And Vice President Pence violated the health policies of the Mayo Clinic when he insisted on not wearing a mask when he visited there this week. He did, however, wear a mask. After a lot of blowback for that maskless visit, he did wear a mask while visiting GM today. So, again, if you're just joining us, I am Alan Piper. I am the senior politics producer, and for some number of weeks now, I don't know, time is a flat circle at this point, the NowThis team and I have been giving you daily fact checks of the President's briefings. We do this because it is important to bring you the words that the President says, because they have power. He is the President of the United States. We would not be serving you well if we did not bring you the information of what he said, but we would also not be serving you well if we allowed him to spread falsehoods unchecked. This is a president who says things that are not true with a regularity that we have basically never seen in public life before. The Washington Post has clocked over 18,000 false statements from this president. We can get into a rhetorical debate over whether these are lies or whether perhaps he believes them himself and therefore they are not lies. Either way, the President of the United States is frequently sharing information that is false, and often, as in the case of his recent reckless suggestions about hydroxychloroquine or potentially people being injected with disinfectant. In many cases, the baseless speculations that this president makes have real dangerous health impacts potentially on the country. And so we are trying to provide real-time factual information to make sure that we are not amplifying false statements by this president. So I was running through the timeline. We reviewed that he has been in office since 2017. In early 2017, his Pentagon urged him to start refilling that reserve of emergency medical supplies, many of which got used during hurricanes, during other national emergencies that have occurred over the last 3 years. President Trump did not take advantage of that opportunity to refill those stockpiles in advance of our current crisis. In 2018, he specifically fired President Obama's pandemic response team that we mentioned had been put together that was part of the National Security Council. He has since denied doing this, but as recently as February of this year, he acknowledged doing it and said that he did it because he wanted to save money. He didn't like keeping people on the payroll who weren't working. Why have a pandemic response team when you aren't having a pandemic? He said that if you needed them, they could be quickly rehired, which is a little bit like firing your fire department and then putting out a help wanted ad the moment a building catches fire. Now, Eve asks, how accurate are the confirmed cases? Surely not everyone has the chance to get tested. And Eve, you have highlighted one of the most significant issues that we are all dealing with. On March 6th, President Trump claimed that at that time, anyone who wanted a test could get a test. But it is not true. It was not true then. It is not true now. There is a long waiting list in New York to get tests, and New York is conducting more tests than any other state in the country, with some 20,000 tests a day. The U.S. has performed just over 6 million tests. President Trump had promised that we would perform 5 million tests by the end of March. It didn't happen. It took till near the end of April. Testing has rapidly ramped up in the past week or so. The president claims that we will soon be doing 5 million tests a day, but the director of the CDC has said that that is simply impossible. Under 2% of the total U.S. population has been tested, and there are over 1 million cases. Epidemiologists suggest that the actual number of cases in the U.S. could be 10 times that high, could potentially be around 10 million. So until we have more widespread testing, we can't know for sure. Recent antibody testing in New York suggests, excuse me, I'm going to cough, and it's not because of the coronavirus, it's because I ate some peanuts. I ate some peanuts before I went on, and one of them stuck in my throat. New York's recent testing suggests that as many as 20% of New Yorkers may have had the coronavirus. Now, there's good news and bad news there. That would mean that the number of people for whom it is not fatal is larger than we thought, but it would also mean that it is much more contagious than we thought. Darlene asks, Darlene's asking about the Obama administration's preparations. So Darlene says, Obama had 8 years to prepare for a threat. So where's his storehouse of medical supplies? Well, the answer is, as I highlighted in part, President Obama's administration prepared a pandemic playbook. It was 69 pages long to give to the next president in line. The document specifically talked about the risk of a new virus for which the country would not have medical countermeasures. President Trump chose to ignore it. There would be no way to know exactly what medical equipment would be needed to supply, but in 2014, President Obama warned that we need to prepare for a pandemic. We need to see it quickly, isolate it quickly, and respond to it quickly. President Obama sought additional funding for increasing our preparedness, and Republicans blocked that funding. Now, you can keep a lot of stuff on hand for a while. Masks actually do have expiration dates, and it really is, while it is possible that the Obama administration could have left more equipment in the store, President Trump has had 3 years. He's in his 4th year now to fill it up, and I want to read the quote of what Susan Rice said regarding this claim that the cupboard was left bare. She says, quote, when the Obama administration left office, we left the national strategic stockpile fully stocked, adequately prepared, but more than the stockpile, we left this incoming administration with all the tools that we had created for ourselves and that they needed to confront such a pandemic. The preparation for something like this isn't a one-time thing. It is a continual thing. President Trump talks about all we have learned, and has Dr. Birx and Dr. Fauci have suggested that the information gleaned from this crisis may help future administrations and future generations deal with their own crises. It would be nice to think so. It would be nice to think that a future administration would not cast aside the information that a previous administration had collected and tried to leave for it to have advantage of. Teresa asks, Michigan protesters entered the Capitol building in Michigan. Why do they have guns, and is it legal? The answer is protesters carrying firearms are protesting Governor Gretchen Whitmer's stay-at-home orders inside the Michigan Capitol as some lawmakers look to expire an emergency declaration. Michigan has long allowed guns inside the Capitol building. Signs are banned, but guns are allowed, which is interesting because freedom of speech is protected in the First Amendment, and the right to bear arms is only protected in the Second Amendment, and even there it is suggested within the first few words of the amendment that it needs to be, quote, well regulated. One Democratic state representative said, quote, the only way you can get a sign into the Capitol is if it's painted on the side of a gun, and I don't think that makes much sense. More than 100 protesters gathered the second time in less than a month. There's been a large demonstration against restrictions to combat COVID-19. This protest is smaller than the earlier one. It is worth noting that in nearly all of these instances, there have been open carry enthusiasts protesting with assault-style weapons displayed in Virginia and in other states. And I would, just as a thought experiment, virtually all of these gun proponents that you see in the footage of these demonstrations are white men. I would, as a thought exercise, like to imagine what would happen if a group of black men with assault weapons ran into the state capitol of Michigan. I'm not going to predict what would happen. I'm just saying, as a thought exercise, try to envision the scene that you think might unfold if that were to happen. Now, we are expecting the President of the United States at any moment. I see that people are gathered. It is interesting to note that of all the people gathered, only one is wearing masks. I'm going to go full screen for a moment, let you see. Of all the people gathered, only one is wearing a mask. Health and Human Services Secretary Alex Azar is not wearing a mask. I don't see anyone else wearing masks, and I see lots of people standing much closer than 6 feet away from each other. I see them leaning into each other and talking to each other. This does not seem to be wise in the age of a global pandemic. Again, we are expecting the President of the United States at any moment. I am NowThis senior politics producer, Alan Piper, and I am supported by many people in our newsroom today. Everyone is working from home. Thomas asks, are essential workers getting hazard pay? And the answer is no. Doctors, nurses, and other frontline medical workers are not getting hazard pay from the government. Grocery workers are not getting hazard pay. The White House has provided money for hospitals, which it says could help pay workers bonuses, but the Washington Post reports that there is, quote, no evidence of hospitals using this money for extra hazard pay. People working on the front line for Amazon, Walmart, and Target were given a $2 an hour raise, but it's important to note that in most of these instances, this still does not amount to a living wage, because many of these jobs are already minimum wage jobs. The federal minimum wage is $7.25. I think it is very interesting to note that as a society, we have said that people who work in food service, in people who sweep our floors, people who clean for us, are not worthy of a living wage. And yet, in a pandemic, we discover that those are, in fact, the very people who are the, quote, essential workers with whom society cannot move forward. And it is imperative that those people be paid a living wage, and also that they have paid sick leave. You don't want your food worker being forced to go to work sick because that worker doesn't have paid sick leave. People are taking their seats, so we do expect the President of the United States to come in at any moment. I will note that the chairs are spaced 6 feet apart from each other, but the people were not seated 6 feet apart when we started here. They were standing very close to each other, leaning into each other, speaking as if we were not in an age of pandemic. There does appear to be a table next to the podium. It is possible that the President will sign some kind of executive order. I'm going to look for information as to what that might be. Again, we are coming to you from the East Room of the White House. I am coming to you from the East Village of Manhattan, from my personal apartment, where my cat sometimes yanks the Ethernet cable out from the wall, and I momentarily lose signal. Should that happen, I apologize. We are working without the support of our full physical studio because we are self-isolating at home, every one of us, in the midst of a global pandemic. So the President should be here any moment. There is not time to go fully through the timeline of events that have gotten us from the first instance of the coronavirus to where we are today. But I will tell you, I'm going to turn up the volume a little. All right, I've turned up the volume. There might be a slight echo for a moment. Marianne has a question. And I'm looking to see if we have an answer. Oh my goodness. All right, there's a very striking answer to Marianne's question. Marianne says, has Georgia had an increase of infection since it opened its businesses? The answer is on Friday. Georgia relaxed lockdown guidelines and allowing nail salons, barbershops, gyms, and other businesses to reopen. On Friday, there were 22,000 cases of the coronavirus in Georgia. Today, there are 26,000 cases in Georgia. So you can answer your own question as to, was it really a good idea to open those nail salons, barbershops, gyms, and tattoo parlors? I think maybe those tattoos could wait. That's what it seems to me. I mean, unless you feel like you need to have your next of kin.
Ladies and gentlemen, the President of the United States, accompanied by Governor Lee of Tennessee.
All right. Here's the President of the United States. My team and I will do our best to fact check him in real time. Sometimes he says more false things than we can get to. If that's the case, I will try to circle back to as many as possible at the end. But here he comes. So this is the President of the United States, and he is accompanied by the Governor of Tennessee.
Well, thank you very much. Please. This afternoon, I'll sign a proclamation declaring the month of May to be Older Americans Month. I don't know if I'm in that category. I have a feeling I am, but I feel good. And our country is making a lot of progress, Alex. I won't tell you that. Making a lot of progress.
President Trump is indeed an older American. In fact, he is the oldest American ever elected to the first term of a presidency.
Our seniors from the virus. I'll also announce vital new actions to safeguard our nursing homes and most vulnerable citizens as we gradually and safely reopen our country, and it's very exciting to see what's happening. We're joined today by Secretary Alex Azar. Thank you. Secretary Robert Wilkie. Robert, thank you very much. Administrator Seema Verma. Thank you. Great job. FEMA Administrator Pete Gaynor. And Chief of National Guard, Bureau General Joseph Lengal. Thanks also to Tennessee Governor Bill Lee.
Secretary Alex Azar is here. The Washington Post has reported that Alex Azar attempted to alert the president on a phone call that he was not responding sufficiently to the coronavirus. On January 18th, Secretary Azar spoke with the president and tried to convey an urgent message, but was reportedly repeatedly cut off so that the president could berate him about his efforts to ban flavored vaping products. By the way, flavored vaping products is a harder phrase to say than you would think.
Hard hit other countries such as Spain and Italy and United Kingdom and Sweden. We're way below other countries. We're deploying every tool, resource, and power at our disposal to...
It is false to suggest that we are way below other countries in the impact of this disease. We have more cases than any other country. We, in fact, have more cases than the next 4 countries combined. And the U.S. accounts for over 26% of all the world's deaths, even though we account for under 5% of the world's population. We have a higher mortality rate than many other countries, including Germany, Austria, South Korea, and Australia and Japan.
Yesterday was announced by Gilead. In early March, my administration advised all nursing homes to suspend all medically unnecessary visits to help slow the spread and to protect our seniors, and especially in our nursing homes. They are having a hard time in those nursing homes. We took action to step up enforcement of infectious disease standards at nursing homes all across America.
Now, this is actually true. What the president is saying is that nursing homes are the hardest hit. The New York Times found that there have been nearly 7,000 COVID-19 deaths that have been verified in nursing homes. At the time of their reporting, that accounted for a fifth of all U.S. deaths. Of course, as of today, U.S. deaths are up to 61,000.
Grants to support home-delivered meals in home care and other services that make it impossible for older people to just do what they want to do. We're helping older people with disabilities, and we're helping them to live independently. We dramatically expanded access to telehealth, a very big deal. For Medicare beneficiaries, the number of Medicare patients using telehealth has increased from roughly 11,000 a week to more than 650,000 people a week. So that's from 11,000 a week to 650,000. That's almost an impossible number to believe, right? But it's really something. They get used to it, and a lot of that's going to be staying with us long after this horrible scourge is gone. Medicare is also paying for labs to provide seniors with at-home testing when appropriate.
Now, the president is highlighting the role that Medicare is going to play in protecting seniors. It is important to point out that in his 2020 budget, he called for a total of $1.9 trillion in cuts over the next decade to programs like Medicaid and Medicare. And he called for spending $26 billion less on Social Security programs, including a $10 billion cut to the Social Security Disability Insurance Program, which provides benefits to disabled workers. In his 2021 budget proposal, he proposed to cut spending by $4.4 trillion over a decade, including $130 billion from changes to Medicare prescription drug pricing, $292 billion from other safety net cuts, such as adding work requirements for Medicaid and food stamps, and $70 billion for tightening eligibility and access to disability benefits. This in spite of the fact that he repeatedly campaigned on a promise of never cutting Medicaid or Medicare.
Thank you, Mr. President, and good afternoon, everyone. I'm very proud of the National Guard and all they are doing to help keep our nation safe here at home and abroad. Today, over 83,000 men and women of the National Guard are engaged at home and abroad, and 45,000 of those are engaged directly in the COVID-19 response. From running hundreds of testing sites around the country to screening passengers at airports to helping manufacture PPE to a myriad of other tasks, the National Guard is there. We know this virus doesn't treat everyone equally, and our senior citizens are at increased risk. In many states, governors have directed National Guard members to help sanitize long-term care facilities, nursing homes, giving older citizens and families and caregivers peace of mind that their environments are safe. The Georgia National Guard, for instance, has sanitized over 700 nursing homes, and this has been replicated at many places around the nation and continues to grow. Additionally, food banks and homeless shelters. In normal times, these are often staffed by our volunteers. Many of them are elderly senior citizens here in America. Now, volunteering puts those great Americans at increased risk. So the National Guard is helping these Americans stay clear of this risk. And doing that, the National Guard is staffing many food banks across the nation where the need for food assistance is increasing across the nation as this virus continues to persist. The National Guard is a big part of our United States Army and our United States Air Force, and we're proud of that. But this role that we play here at home, in the homeland, under the command of the governors in our states, is distinctly and uniquely National Guard business, and we're very proud of that. So, Mr. President, thank you. Thank you for the support that you give our military and the National Guard and all the men and women who serve. They are proud to serve our nation. Thank you for letting me talk about the Guard today. Thank you, sir.
Thank you very much, General. That's great. 4 stars. That's a lot of stars. Very impressive. That's right, but that's okay. That's very impressive. You deserve them. I do want to...
4 stars is a lot of stars. The president has correctly counted the number of stars. The president is prone to highlight numbers when he spots them.
And that's worked out very well. We had Phil Murphy here from New Jersey, governor of New Jersey today, wonderful man. A lot of progress is being made there. And we had John Bel Edwards yesterday from Louisiana and Ron DeSantis the day before from Florida. With just tremendous progress, three very exceptional men. And they're doing a really good job, as you know. So, and we have others coming in. They'll come in one or two a day, and we're seeing them, and whatever we can help them with, we help them with, and we help them with very, very quickly, General, right? So it's been very good. My administration is doing everything possible to support the state-led management of nursing homes, and here today is a governor who I happen to like a lot. And he's done a fantastic job in a fantastic state, a state that I happen to like a lot. It's called Tennessee. For some reason, they like me. I haven't figured that out, but they like me in Tennessee, so that's good, Bill. Please come up. Governor Bill Lee, please.
Thank you, sir.
Thank you.
Thank you very much, Mr. President, and thank you to your team, many in this room that we have worked with. You are guiding America through a tremendous crisis, and you're doing it incredibly well, and America is very grateful for that. And we are grateful in Tennessee for the partnership between the federal government and states like ours.
Now, I do want to point out that governors of other states, both Democratic and Republican governors, have said the reverse, that there has been a poor partnership between the federal government and the state role, and that states have had to step up and do the job that the federal government would normally do. For instance, on March 16th, when President Trump first had his very first call with governors about addressing the crisis, he told them that they were on their own to get medical supplies, that they should do their best to obtain them themselves. As a result, the states found themselves bidding against each other. Governor Cuomo compared it to being on eBay with 50 different states. What ended up happening is that governors stepped up to fill the leadership gap that was missing from Washington. Governor Newsom of California suggested putting together a consortium of states, like a collection of states, like a group of United States, so that they could make collective requests of suppliers and not be bidding against each other for medical supplies.
And those that have a loving legacy of being our neighbors and our friends and our grandparents. And it's time for us to protect them. And we should do so by pursuing social distancing, for example, in every way that we can with them. And the distance is sometimes a great gulf. I haven't hugged my own elderly mom in 8 weeks.
It is refreshing to hear a Republican governor saying that it is important to protect the elderly. It is not that long ago that the lieutenant governor of Texas suggested that grandparents should be happy to give up their lives for the sake of the economy. And President Trump has made similar suggestions when he has repeatedly brought out the phrase, "We can't let the cure be worse than the problem," the idea that a faltering economy is potentially worse than many older members of the population dying.
Our country, we must remain especially vigilant in sheltering the most vulnerable older Americans. To that end, today I have several important announcements. First, in addition to all of the supplies we've already distributed, FEMA will send supplemental shipments. And I have to tell you, Pete, what a job you've done. Everybody was at the last call with the governor. So many of the governors said, I want to thank him for calling. He called on Easter morning, and he's calling them all the time. And you call them on Sundays, and you call them every time, all the time. And I tell you, they really appreciated it. They really do. You've done a fantastic job. Pete Gaynor, FEMA. But FEMA will send supplemental shipments of personal protective equipment to all 15,400 Medicaid and Medicare certified nursing homes in America, right, Pete? Second, CMS is providing states with $81 million from the CARES Act to increase their inspections of nursing homes at this very critical time. We have to do that. We have to do that. That's a spot. It's a spot that we have to take care of. I guess you could call it a little bit of a weak spot because things are happening at the nursing homes and we're not happy about that. We don't want it to happen. So we're checking that out very carefully and very methodically. Third, this week we'll be finalizing a new rule requiring information about coronavirus cases in nursing homes to be reported directly to CDC and testing data to be posted online so everyone gets to see it. This rule also requires nursing homes to report cases to residents and their family members.
This is an interesting development. It was Senators Ron Wyden and Bob Casey that called on government agencies on April 2nd to release a list of nursing homes with confirmed cases of COVID-19. There seemed to be resistance at the time from the White House, but it does seem that the White House and the senators have since gotten in sync on this, or that the request of Ron Wyden and Bob Casey appears to be being fulfilled.
The administration will never waver in its relentless commitment to America's seniors. We owe them a sacred and unbreakable obligation, and we will fulfill that obligation with every resource and power that we have. We are working very hard with our seniors, and we're working very hard with our nursing homes.
And again, I highlighted the number specifics earlier, but President Trump's budgets have called for cuts to Social Security and to Medicare, despite his having run on specifically the promise that he would never do that.
We will protect you as American citizens, and that goes even beyond seniors. We're protecting this country. Our cherished seniors.
There are to date over 61,000 deaths in this country, so it is not accurate to say that we are successfully protecting the citizens of this country.
Could not be anything near where it is without our incredible seniors. We'll show them the same love and loyalty they've shown us and they've shown our nation every day of their lives. No effort will be spared to give America's seniors the care and support and devotion and love they have earned and that they deserve. In a few moments, I'll sign a proclamation we've designed a very special plan, and it's going to designate Older American Month. So this is Older Americans Month. But first, I'd like to ask Secretary Azar, Secretary Wilkie, Administrator Verma, Administrator Gaynor to share what their department and agencies are doing to help our nation's seniors. So just come on up and maybe you could say a few words. And you've made a lot of progress. Come, Alex, why don't you start? Thank you.
Well, thank you, Mr. President, for your leadership during this pandemic and for the work you've done throughout your administration to protect older Americans. I'd also like to thank the older Americans and advocates we have here today, including...
I don't want to preempt Secretary Azar too much, but I do want to highlight the fact that he was trying to get President Trump to take this threat seriously at a time when President Trump was not seemingly willing to do it. On January 18th, Washington Post reports that Secretary Azar tried to have an urgent call with the president about the crisis. The president reportedly cut him off to berate him about his handling of an attempt to ban flavored vaping products, and then the president hung up and then went golfing. We also know that in January, Secretary Azar requested funds to fight the coronavirus, and the White House resisted this request. He wanted $136 million. Later, as the crisis got worse, he asked for more money. He asked for, I think it was about $4 billion. And according to the Washington Post, that request led to a shouting match in the White House.
Ensuring not only that the meals are getting to seniors, but that the meals are coming from local restaurants whose businesses are struggling. It's not just about meals and services. We also recognize that older Americans may be facing mental health challenges and feeling isolated. Florida's Aging Network, for instance, is combating social isolation by providing electronic tablets to nursing home residents to help them communicate with loved ones. We're also working to protect the rights of older Americans in accessing health care. Our Office for Civil Rights has been taking action to ensure that states and healthcare providers do not discriminate on the basis of disability or age in the allocation of medical care. We've already had 2 states remove such discriminatory policies from their triaging guidelines as a result of our Office for Civil Rights work. Finally, as the President and others mentioned, we've worked closely with states to ensure that they can test especially vulnerable populations like those living in nursing homes and those who care for them. This work to protect seniors and empower them will continue throughout the pandemic as we reopen our country and keep America's seniors as healthy and as independent as possible. Thank you all for what you do in this effort. Thank you, Mr. President.
Mr. President, thank you, and thank you for everything you have done to transform the Department of Veterans Affairs on behalf of the nation's 9.5 million veterans. 75 years ago, the men of the 28th Marine Regiment raised the American flag on Mount Suribachi. No event better evoked the sacrifices and the triumphs of the 15 million Americans who put on the uniform during World War II. A few years after Iwo Jima, the soldiers of the United States 8th Army defended the Pusan perimeter, and Marines fought through and out of the Chosin Reservoir. Veterans of those terrible times are still with us today. Early on in this crisis, President Trump gave me very explicit orders to do everything possible to protect the lives of those precious Americans. The Department of Veterans Affairs has 134 nursing homes, but more than half of the residents in those nursing homes fought in wars with battles with names like Guadalcanal and the Bulge and Inchon. Of the 78,000 residents in our nursing homes, we have tested all of them for the coronavirus. We have tested all of our staff in those nursing homes. Our infection rate is low. Many of our homes have few, if any, positive cases. But still, as the President noted, we had to make a very tough decision early on. After all of these veterans had gone through so much on the battlefield, we had to tell them at this stage in their lives that we were depriving them of the sustenance of their families and friends because we had to protect their lives. Because of the President's directions to me, we have been able to contain the virus in our nursing homes. And now we are taking those lessons that we've learned from VA across the country to protect patients across America. We are the federal experts in gerontology. We are helping 38 states and territories handle the surge of patients dealing with this virus with our partners, our great partners at FEMA, and even by direct action through the governors. Aiding America's elderly is central to all of our efforts. We deployed VA staff, as the President noted, to veterans' nursing homes owned and operated by the individual states. Early on, Governors Charlie Baker and Phil Murphy moved to protect their veterans, and they asked us for help. In addition to Massachusetts and New Jersey, we were helping in Alabama, Florida, and Tennessee. In California and Mississippi, New Mexico, Oklahoma, Rhode Island, and Texas, we have taken in non-veteran nursing home patients and state veterans nursing home patients into our VA facilities. We are helping elderly Americans wherever we find them. Mr. President.
So this is Veterans Affairs Secretary Robert Wilkie. I do want to highlight that while he is honoring U.S. veterans in this speech, he has actually made statements honoring traitors to this nation who took up arms and killed actual U.S. soldiers. In a speech commemorating Confederate leaders, he referred to them as martyrs to a lost cause. The Confederacy was a lost cause. They lost. They took up arms against the United States. in defense of slavery, and they suffered a terrible and humiliating defeat.
Thank you, Mr. President, and thank you for your commitment to...
I say that, by the way, as a native Virginian. I know that I have just angered many members of my childhood community, but it is true.
Medicare Advantage program is seeing premiums at a 13-year low, and in our Part D program, it's a 7-year low. But today I want to focus on nursing homes. In the scheme of life decisions, placing a loved one in a nursing home has to be one of the most difficult decisions. And when you make that decision, you want to know that you can stay connected with your loved one and that they're going to be safe and have the best quality of life. And that's why the decision to restrict visitation in nursing homes was a heartbreaking decision. And our thoughts and prayers are with the families and the patients during this very uncertain time. But the tragic reality is that the coronavirus seemed almost tailor-made to put major pressure on nursing homes. And countries across the world have struggled with their nursing home populations. But the President's early action around nursing homes has saved countless lives. And even before the coronavirus, we have been working on a strategy to improve quality in nursing homes. The strategy focused on quality, oversight, enforcement, and transparency for patients and their families so they understand exactly what's going on in nursing homes, about the conditions there, and reducing regulatory burdens so that nursing home providers can focus on providing care to their patients instead of paperwork. We've overhauled the entire survey system and implemented a common tool across the entire nation to ensure that our inspectors were being consistent, objective, and that's actually resulted in an increase in the number of fines. And we've updated our websites so that patients and their families have the latest information on the quality in a nursing home and making it very clear when nursing homes have had significant cases of abuse and neglect. And those improvements that we've made it possible when the coronavirus hit for us to take very rapid action on several fronts. We launched an unprecedented transparency effort, and that requires nursing homes to inform patients and families when there's an outbreak in the nursing home, and to also report that information directly to the CDC. And that's going to be important to our efforts around surveillance going forward as we reopen the country. And also, we increased reimbursement for labs so that they could do more testing in the nursing home. And that's going to be very critical, as I said before, to our monitoring and surveillance efforts. Also, starting in February, we issued a series of 9 guidance documents specific to coronavirus and controlling infections in nursing homes. And just for some perspective, normally these types of guidance documents can take months, sometimes years. But the CMS team worked days and nights and weekends to make sure we got this information in the hands of our nursing homes to do everything that we could to protect our vulnerable seniors.
Now, so Administrator Verma is talking about how her office put out guidelines in February. It is worth noting that in February, President Trump was still referring to this as, quote, their new hoax. This was something that Democrats and the media were just trying to use as a gotcha. He repeatedly in February downplayed the threat of the disease. Now, by March 11th, at a nursing home at the center of the outbreak in Washington State, which was at that point the U.S. epicenter, 26 residents of the nursing home died. Just 2 days before that, President Trump was comparing it to the flu, and a few days after that, he said, it's incredible, but it's something that we have tremendous control over. It was, of course, not until about a week later that he issued his social distancing guidances for the nation as a whole.
State partners to ensure safety in our nursing homes. But the President has directed us to do more, and so as part of our Opening Up America efforts, we are going to oversee the Coronavirus Commission for Safety and Quality in Nursing Homes. And the commission will comprehensively assess the response. It will identify best practices and also provide recommendations for how we go forward to protect our nursing home residents and make sure we are providing the best quality of life. And in closing, I want to speak directly to our nursing home residents, their caretakers, and their families. Your pain is our pain, and we are doing everything we can to support you. And to the healthcare workers on the front lines providing care and comfort to our nursing home residents, we thank you. And thank you, Mr. President, for your consistent leadership and unwavering support for our elderly citizens. Thank you.
Do you want to tell them that we're going to have some big news very soon on insulin?
That's right.
It's a big deal.
We're doing everything we can to lower the price of insulin for our seniors, and we'll have some great announcements coming up very soon to lower the price.
Some big news. Great news. Good. Thank you.
Thank you, Mr. President, Administrator Verma, and members of the Coronavirus Task Force. Let me focus on the logistics in our effort to deliver personal protective equipment.
That was very interesting, what was just alluded to, that there's going to be something done to lower the price of insulin. It sounds like it might be just for seniors and not for everyone. I do want to point out that when Secretary Alex Azar of Health and Human Services was CEO of Eli Lilly, he oversaw that company, the first company to produce insulin. During the time that he oversaw it, the price of insulin literally doubled, and he was involved in doubling the price of insulin. We have a video about that. I'm going to see if we can add it to the comments here.
To these 15-plus nursing homes. Each kit is individualized for each nursing home based on the level of staffing and the 7 days of our supply calculation. Over the course of the next 60 days, we're providing each of the nursing homes with 2 separate shipments of 7 days of supplies, totaling 14 days of supplies by the beginning of July. The first shipment of supplies begins next week. These initial shipments will focus on metropolitan area sites such as New York City, Northern New Jersey, Boston, Chicago, and Washington, D.C. The second shipment of supplies begins in early June. The goal is to have all supplies delivered no later than July 4th. Assisting us in this endeavor is Federal Resources, a small business based out of Stevensville, Maryland, who specializes in chem bio equipment support with focusing on kitting solutions for the Department of Defense. They will help us distribute the following PPE items: 608,000 pieces of eye protection, 6.9 million surgical masks, 6.4 million gowns, 31.4 million pairs of gloves. And finally, I would again like to extend my gratitude to the President for his leadership on this project, as well as to thank my fellow members of the White House Coronavirus Task Force and their continued partnership. Together, we have turned a critical demand for PPE for our seniors and frontline healthcare workers into reality. Thank you, sir.
Thank you, Pete. President. Thank you. Okay, thank you all very much. I think we'll sign. Would you like to come up? Come on up. Come on up, Aaron.
Okay, so the President is now signing his declaration that it is Protecting Older People Month. And I just want to highlight how this administration is failing to demonstrate its own social distancing guidance. See how closely everyone is crowded together. Also, what is the point of avoiding handshakes if you are going to touch a pen and then hand that pen off to someone else? But there we do see the executive order that the President has signed. He is now handing out more pens that he has touched with his hand, and then everybody else is going to touch them with their hands and then pass them off to other people as well. And of course, no one is wearing a mask at all. Now let's hear what else the president has to say.
Some questions maybe on this, and we might venture into different territory also, I think. John, please. I guess. Not a wise one, but it's an
we could
invitation.
venture straight into other territory. The Vice President said just a short time ago he believes that General Michael Flynn may have unintentionally lied to him or misspoken when he talked to him and did not include his meeting with the Russian ambassador to the United States.
Yeah.
Do you believe that General Flynn may have unintentionally misled the Vice President?
Well, I really have to talk to the Vice President, but I'll tell you what, General Flynn was under enormous pressure, and it was an artificial pressure because what they did to General Flynn was a disgrace.
A reminder, General Flynn pleaded guilty to lying to the FBI. He also was guilty of working as an unregistered foreign agent. This is President Trump's former national security advisor.
Rely on what the Vice President said. I can say this, and I think you understand this, John, very well. What happened to General Flynn should never happen again to a citizen of this country. Yes, please.
That is true. No citizen of this country should lie to the FBI or operate as an unregistered foreign agent. So, yes, what happened to General Flynn should not happen to any citizen.
Based on everything I see, look, I'm not the judge, but I have a different type of power. But I don't know that anybody would have to use that power. I think he's exonerated everything. I've never seen anything like it. What they did, what they wrote, you see this, General. You wouldn't want this happening to you, what they did to General Flynn. And it's just disgraceful. So, you know, I guess we'll get to that maybe someday or maybe not. Hopefully we won't have to get there.
Bring him back into your administration?
Well, I think he's a fine man. I think it's terrible what they did to him. It's something that nobody's asked me, but you're asking me for the first time. I would certainly consider it. Yeah, I would. I think he's a fine man. I think he's got a great family. He loves his son. I will tell you, his son was around a lot, and he loves his son, and as people generally do. And they did everything possible to destroy him. And he's still breathing very strongly, but they really hurt him very badly. Very, very unfair. Kristen?
Thank you. Quick follow. In what capacity, I do have a coronavirus-related question, but in what capacity would you bring him back?
Well, we'd look. I mean, I'm not even, this is really the first time I've been asked the question, but I think he'll be fully exonerated one way or the other. And so certainly he'd be capable of coming back. He suffered greatly.
Again, Michael Flynn pleaded guilty to lying to the FBI. Michael Flynn is an odd figure. He, prior to being a member of President Trump's campaign team, was a frequent contributor to Russia's state-run propaganda network, Russia Today. There is footage of him in a tuxedo at a gala with Vladimir Putin. He's an odd fellow to have had on a presidential campaign or on a White House national security team.
At the original location, and I think
also, one of the details about Mike Flynn that is particularly strange was his alleged role in a plan to forcibly remove a Muslim cleric living in the U.S. and deliver him to Turkey in return for $1 million, according to people familiar with the investigation. This is something that Mueller's team was looking through. This was while Michael Flynn was working as an unregistered foreign agent for Turkey. A plan to forcibly remove in exchange for $1 million. Another common term for that would be hired kidnapping.
we're at the news conferences over the last few days, the governors they said we've never had a case where we couldn't get a ventilator. And a month and a half ago, you were screaming, ventilator, ventilator. I'm just looking at the test numbers. We have more tests. We have given more tests and the high-quality tests than every other country combined. And I say it, the friend of mine, South Korea President Moon, called me. They talk about South Korea, and they've done a really good job. But he said, what a job you've done. This is a much bigger country, you understand. He said, what a job you've done on testing. So the testing and the...
It is really misleading to suggest that the United States has done a better job on testing than South Korea. The United States and South Korea had their first case of the coronavirus on the exact same day, January 20th. South Korea immediately went into high gear and started within 2 weeks, a nationwide plan for testing in the country. And as a result, they have kept their death toll at around 240. The U.S., starting on January 20th at the same time, is only at the end of April getting serious about testing, and we have had over 61,000 deaths.
I don't think anybody's done a better job with testing, with ventilators, with all of the things that we've done, and our death totals, our numbers per million people are really very, very strong. We're very proud of the job we've done.
It is absolutely false to suggest that as compared to other nations, we are doing better. We have the highest death toll of any country. We have the highest case count of any country. We account for about 30% of the world's cases and close to 30% of the world's deaths.
Any closer to the goal of having Nicolas Maduro leave office?
Well, I need it, and I sign it, and we do have executive orders, and they help us a lot, and they've helped us a very lot here. We also signed things having to do with production, as you know. I've used that very, very powerfully, the act.
He actually has not used the Defense Production Act very, very powerfully. Governors were desperately calling on him to use it in early March. He did not. He did not invoke it formally until the end of March, and even so, he has not used it as aggressively as could be done. Governor Cuomo was calling for him to ask all apparel makers in the country to begin making masks and gowns, which he could have done. He could have ordered them. It would have been good for our healthcare workers. It would have been good for the companies that these goods were being ordered from. But it wasn't done, and instead we ended up with nurses wearing garbage bags as protective gear here in New York.
And Tennessee's a great story, but we have other governors, friends of both of ours, that are doing really a good job. I will say this, Governor Murphy and Governor Cuomo have a tougher situation because that's really a hotbed. It's a very, very dense area. People don't realize. I think New Jersey, believe it or not, is the single most dense area in the country. Who would think that? But the governor's done a terrific job, and Governor Cuomo, likewise, is working very, very hard and speaking to me all the time, and whenever we can help him, we do. And we're helping him, and he's helping his state. That's what he has to do. Thank you.
How is the operation going, though? And do you feel, my second question was, do you feel you're any closer to having Nicolas Maduro in Venezuela?
I think the operation is doing really well. I think that things are being discovered that you wouldn't have thought possible. The Abbott machine, Abbott Laboratories, a great scientific company. They came up with a machine that I would say 2 months ago nobody ever heard of this machine. And all of a sudden, boom, the people come into my office, they get tested. It takes them 5 minutes, and they feel very good. Some of them have never been tested. But these are, equipment and tests that nobody ever thought even possible 3 or 4 months ago are being used commonly now. I looked at the numbers, and we're over 6 million tests. And you add up everybody together, they don't have anywhere near that. So it's an incredible...
Oh, that is not true. The president has routinely said that the 6 million tests done in the U.S. are more than all the other countries combined. All the other countries combined have performed more than 20 million tests, and 20 is more than 6 if you're not familiar with the numbers.
I thought you'd be talking about such a thing. 2 months ago was impossible. All we talked about was the economy, how well it was going. But today we have to talk about that. Our country has really stepped up. Our generals have stepped up, and our admirals have stepped up.
And the president is just acknowledging that 2 months ago he was not talking about this, which is and should be shocking, given the fact that his national security team had given him warnings about it in November. And my mouse has gone dead, and I apologize. You're going to see me wrestling around to try to fix that.
It was a month from China. China never gave our country anything. China gave us nothing, not 10 cents. And whether it was Biden in charge of China, which was a joke because they ripped off our country for 8 years. And in all fairness to Biden and Obama, this went on long.
Okay, there are some false statements happening here. I'm fixing my mouse. I'm going to circle back to this.
And then we signed a trade deal where they're supposed to buy, and they've been buying a lot, actually, but that now becomes secondary to what took place with the virus. The virus situation is just not acceptable.
Do you think that withholding information about the virus is related to them trying to undermine your re-election?
I don't want to cast any dispersions. I just will tell you that China would like to see sleepy Joe Biden. They would take this country for a ride like you've never seen before.
Mr. President. Mr. President.
Mr. President.
Mr. President.
Mr. President, yes.
Please.
Right, with the unemployment numbers coming out today, 30 million now unemployed, have you given any thought to possibly extending the $600 extra in unemployment benefits that are given out now? They will run out, and that will run out in July.
They are looking at it, and they're taking a very strong look, and we'll be reporting to you very shortly. I will say...
So the president's remarks about China, a lot of false things went through there. I was trying to fix my mouse, and I will try to circle back to some of them, but I do want to say that in January, he said, quote, "I think our relationship with China now might be the best it's been in a long, long time." And President Trump also, throughout January and February, praised China's handling of the coronavirus.
I don't want to say that, but certainly it could have been stopped. It came out of China, and it could have been stopped, and I wish they stopped it, and so does the whole world wish they stopped it. John?
Mr. President, on unemployment, there are many businesses who are concerned that as America opens back up again, because of a provision in the CARES Act that gives an additional $600, they won't be able to get their employees back because they'll make more money staying at home than they would if they came back to work, which has caused some governors to suggest that they might strip those people of their unemployment insurance if they refuse to go back to work. Is that something you would support?
Well, we're looking at a lot of different things. I brought this up before it was done. This was a Democrat point, and I said, some people are going to be treated unfairly, and some people will be treated, they didn't get into the kind of formulas the way I saw it. I said exactly that this was going to happen, but when you think about it, it's basically we're being generous with people that it's short term, and we're being very generous with people that lost their jobs or potentially would lose their jobs. So it's not the biggest problem that I've ever heard of. They're getting a little bit more money. In some cases, they're getting more money than they thought they would have gotten. A lot of employees are saying now the job is more important, because the employer is not going to forget that. But it was something that I brought up at the beginning, and nobody wanted to listen. Yeah, please.
Follow-up regarding Joe Biden. Your campaign and surrogates going after him pretty hard with regard to these allegations from Tara Reade. What do you say to Joe Biden?
I don't think so. I don't think they're going after him hard with regard to Tara Reade.
Allegations, and what do you say to Joe Biden?
I don't know anything about it. I don't know exactly. I think he should respond. It could be false accusations. I know all about false accusations. I've been falsely charged numerous times, and there is such a thing. If you look at Brett Kavanaugh, this is an outstanding man. He was falsely charged. What happened with him was an absolute disgrace to our country, and I guess 3 of the 4 women have now admitted that.
That is not true.
Give me a break. I mean, take a look. 36 years. That is, look, this is a fine man. I saw a man suffering so unfairly. I'm talking about Brett Kavanaugh. But I don't know. I can't speak for Biden. I can only say that I think he should respond. I think he should answer them.
Another question on Biden, Mr. President. Another question on Biden.
Thank you, sir. On China, a moment ago you said that China, it's possible they could have chosen not to stop the spread of the virus. Are you insinuating they intentionally let it spread?
Well, they could have done it, and I'm just saying, well, one of two things happened. They either didn't do it, and, they couldn't do it from a competence standpoint, or they let it spread. And, I would say probably it got out of control. But, there's another case that how come they stopped all the planes and all of the traffic from going into China, but they didn't stop the planes and the traffic from coming into the United States and from coming into all over Europe. I mean, look at Italy. Look what happened to Italy. And it's very lucky. This country is very lucky, and I'm very lucky that I put the ban on China, as you know, very early on in January.
It was not early. Other countries did bans on travel from China at around that same time, and it was not, in fact, an actual ban. It was a series of fairly loose travel restrictions that allowed some 40,000 authorized travelers to enter the country after it went into effect.
A lot of those people went to Italy instead, and it's been a very, very tough place, Italy.
And then on holding them accountable, is that something you prefer to do now in the next few weeks?
No, I don't want to do that. I want to find out what happened. I think we'll be able to get a very good, very powerful definition of exactly what happened. We're working on it strongly now, and I think it's going to be very powerful. But they could have stopped it. They are a very brilliant nation, scientifically and otherwise. It got loose, let's say, and they could have capped it. They could have stopped it.
This is coming from a president who has not been successful in stopping this disease in this country. Unlike China, the U.S. had the heads up of seeing what happened in China. The U.S. had early warnings that China did not, because the disease started there, as far as we know. And to date, there are now more cases in the U.S. than there ever were in China.
Saying those things about China, and now.
Well, what's changed is the following. We did a trade deal, and everybody was very happy. There's nobody ever been tough on China like I've been tough on China. I got elected, at least partially, because of borders and military and different things. But one of the things I'd say is how China and other countries are ripping us off. So recently we signed a trade deal with China a number of months ago. China's buying billions of dollars worth of our product, our farm product and other product, manufacturing product, and it's been a great deal. But then we noticed a virus, and it's not acceptable what happened. It came out of China, and it's not acceptable what happened. And now what we're doing, Jim, is we're finding out how it came out. Different forms. You've heard all different things. You've heard 3 or 4 different concepts as to how it came out.
The president seems to be alluding to a conspiracy theory that this was a man-made virus, something out of basically a Stephen King novel. Scientists, researchers, doctors, and immunologists have said that the virus is the product of evolution, not synthetic creation or lab manipulation, as some conspiracy theories have suggested. But the President and the Secretary of State have continued to advance these conspiracy theories.
Great deal for our country. But after that, all of a sudden we heard there's a virus, and a virus is coming in. That changes my mind very greatly. That's a whole different thing. So you can have good trade deals. That was earlier on, the trade deal. I made the trade deal earlier on. And it's a great deal. We're taking in billions and billions of dollars of money in different forms, including the fact that we have a 25% tariff on $250 billion. It's a tremendous amount of money.
President Trump routinely falsely suggests that tariffs on Chinese goods are paid by China. They are not. That is not how tariffs work. The tariffs are paid by the U.S. importers. A tariff on Chinese goods is a tax on Americans.
Something happened. I don't say misleading or not. I'll let you know that. I mean, I'll be able to give you that answer at some point in the hopefully not too distant future. But I will tell you, you take a look at what happened to this world. A month and a half, 2 months ago, we had the strongest economy in the history of the world, and all of a sudden I have to close the economy.
It is not true that we had the strongest economy in the history of the world. It had been stronger at many times by many metrics.
Nobody's ever seen anything like it. And so have most of the countries of the world. Think of that. Most of the countries. 184, you tell me. It's
185.
184, 184 countries.
It is 185 countries.
it's something that is going to have to be dealt with. We're going to have to see.
Mr. President, on the issue of loss, Vice President, on the issue of loss, Vice President Biden has said you should lower the White House flag to half-mast. Are you going to do that? And are you thinking about leading the nation in a moment of mourning?
Nobody said that. I mean, I would not mind doing that. I would say not only the White House flag, we could do that. In fact, it's something that I will be talking about later on. We have a meeting on various things. That's one of the topics, and we're going to bring that up. So I think lowering the flags would be something very appropriate.
Thinking about leading the country, though, in a moment of mourning for all of the lives lost, the more than 60,000 people.
Of course I am. I don't think anybody can feel any worse than I do about all of the death and destruction that's so needless. Nobody. But I also have to make sure that we handle the situation well. Nobody's thinking about it more. Nobody has spent more time late in the evening thinking about what's happened to this country in a short period of time. But at the same time, we have to get our country open again.
The president says that nobody has felt the pain of these deaths more profoundly than he has. Nobody has spent more time late in the evening focusing on it. I would like to call attention to his Twitter feed. The president seems to spend his late evenings and early mornings tweeting insults at Democrats, complaining about the Russia investigation, and various other complaints attacking the so-called fake news. A New York Times analysis of over 30 hours of these briefings shows that he spent about 4.5 minutes on condolences out of that entire, all of these briefings, and about 45 minutes on self-congratulations, and about 3 hours total on a combination of self-congratulations and attacking others.
Looking at that, John, separately from... Correct. But we're looking at exactly where it came from, who it came from, how it happened, separately and also scientifically. So we're going to be able to find out.
And my question is, have you seen anything at this point that gives you a high degree of confidence that the Wuhan Institute of Virology was the origin of this virus?
Yes, I have. Yes, I have. And I think that the World Health Organization should be ashamed of themselves because they're like the public relations agency for China. And this country...
So the World Health Organization declared a global emergency 6 weeks before Donald Trump declared a national emergency. In January, when the World Health Organization was briefing the rest of the world about the danger of this crisis, the President of the United States was downplaying it, and it was the President who was praising China on January 23rd. On January 24th, he tweeted, "China has been working very hard to contain the coronavirus. The United States greatly appreciates their efforts and transparency. It will all work out well, in particular on behalf of the American people. I want to thank President Xi."
Safe cities, we want sanctuary, but we want sanctuary for our citizens. And we don't want sanctuary for criminals that came into our country illegally, and they have big records and records. I won't go into the type of crimes, but the crimes are the ultimate in evil in many cases. No, we don't want them to have sanctuary.
So the president is getting into a lot here, and I can't get into it all, but I do want to highlight that immigrants are far less likely, both documented and undocumented, are far less likely to commit crimes than people born in the United States. I also want to highlight that President Trump is weirdly saying that because this virus started in China and spread to other nations, that China should be held to some kind of account for it, that it is their responsibility, and that they are somehow criminal in this. I want to say that the H1N1 virus started in North America. We see conflicting reports as to whether it started within Mexico or within the United States, but either way, it started absolutely in North America and spread to 214 countries. As far as we can tell, no country on earth has suggested that there needs to be retribution against either Mexico or the United States for the H1N1 flu.
Now, it can never be a total victory because too many people have died. All over the world, people have died. In our country, in every country. I'm looking at the new list of countries. Look at what's going on with Russia. Look at what's going on with Spain is so incredibly harmed and injured by this. So many people are dying. This is not something where you'll go to your traditional, this was an experience. This is not an experience. This is a very bad experience. But what I want is we want the virus gone, and we want to have a vibrant economy. We want people back. We don't want people necessarily sitting like these incredible people in front of me where they're sitting 6 feet apart. Instead, I want our country back. I want people to go out and see football games and baseball games and basketball and hockey and golf and all of these sports and not...
61,000 Americans have died from this. The president has a seeming fixation on getting sporting events going again. It is not the top priority for most Americans. A PBS-NPR Marist poll released this week showed that 90% of Americans oppose large sporting events until there is more widespread testing or a vaccine.
Very straight up almost, right, Deborah? Very straight up. A friend of mine, great gentleman, president of Brazil. He's really a friend of mine. He's a great man. But they're having a hard time. They're going herd. Sweden went herd. But, when they say herd, it's really, in Sweden in particular, the bars you can't go to, certain areas you can't go to. A lot of the people are saying, well, the prime minister doesn't have to say stay in your apartment, stay in your house. They're staying there. They're not leaving. So, it's really not quite what was reported, but the number of deaths are tremendous in Sweden compared to the countries that surround where they did very strong lockdowns. And we were discussing that, Deborah, before. It's a very big difference. It's a very big difference. But again, Sweden didn't go really herd as you understand it. And also the people of Sweden, very smart. They're staying in their houses. They're not going out and now, are some? Yeah, I guess, some. But they've lost a lot of people in Sweden. Yes, John?
Mr. President, could I just come back to the...
Yeah, I'll get you in a second.
Can I get back to what we were talking about just a second ago?
Sure.
I missed in the interruption. Are you suggesting that maybe you have some evidence that this was not a naturally occurring virus?
We're going to see what it is. You're talking about the virus and where it came from?
Yeah.
No, we're going to see where it is. We're going to see where it comes from. And, look, every theory. You had the theory from the lab. You had the theory from many different, the bats and the type of bat. And the bat is 40 miles away, so it couldn't have been here and it couldn't have been there. And there's a lot of theories. But, yeah, we have...
So the president seems to be giving credence to a conspiracy theory. It is not a new look for him to do. Remember that when he was facing Ted Cruz for the Republican nomination, he spread a baseless conspiracy theory that Ted Cruz's father was involved in the JFK assassination. Of course, it was the utterly baseless conspiracy theory about President Obama's birth certificate that turned President Trump from a figure of light entertainment on a reality show to a figure of national politics in the first place.
It's approximately $1 trillion, a little bit more as I understand it, $1 trillion. But we can do that in I think probably a little bit of a more forthright manner. You start playing those games and that's tough. We have the dollar to protect. We want to protect the sanctity of the dollar, the importance of the dollar. It's the greatest currency in the history of the world. It's become stronger. We have a very strong dollar. That's why we're borrowing at zero interest rate. With all of the stimulus that we're talking about, that sounds good though, General, doesn't it? We're paying zero interest, so essentially right around zero, but zero. And you want to...
Zero interest is good for many people in the economy. It is certainly good for people who own a lot of stock. However, for families who are trying to keep money in a savings account and build a future for themselves that way, a low interest rate, an interest rate of zero, or close to zero is very destructive. It means that it becomes costly to even keep money in a bank instead of being a way for a family to build a sustainable future for themselves.
And we'll think about what's happening. They want to help the states. They want to help bailouts. And, you know, bailouts are very tough. And they happen to be Democrat states. It's California, it's New York, it's Illinois. You start with those three. And the Republican states are in strong shape. You know, I don't know, is that luck or is that talent? Or is it just a different mentality? But the Republican...
Okay, so there's several things going on here. So Mitch McConnell floated the idea of allowing Democratic states to go bankrupt, saying that Democratic states should not get aid. And now President Trump is saying that the coronavirus rates are higher in Democratic states because of potentially, I think he just said, competence. A couple of things there. There are more Democrats in this country than Republicans. There are more people in blue states than red states. The way our districts are drawn, the way the Electoral College is formed, makes it appear to be a 50-50 sort of thing. But the fact of the matter is that most people in America live in cities, and most cities, even within red states, are blue cities. In cities, you have more people. Where you have more people, you have more possibility for the instance of virus spread. Also, this idea that blue states are asking for a bailout, Governor Cuomo has been repeatedly hitting the absurdity of this idea. The large blue states contribute far more in taxes than they get back in services. For instance, the state of New York gives close to $30 billion more to the federal government in taxes than it gets back in federal services. Now, you want to compare that to Kentucky, Mitch McConnell's state. Kentucky gets $37 billion more in federal services than it pays in taxes. In essence, blue states are bailing out red states every year. If I'm not mistaken, Texas is the only red state that is self-sufficient. The rest are all essentially taker states, all being subsidized by the taxes that states with larger populations are paying. So it is quite striking to be phrasing it as a bailout for the states that have suffered the worst incidence of coronavirus to ask for back some of the money that they contribute to the federal government.
Like you're potentially open to Leader McConnell's call that states should apply for bankruptcy? Is that what you're saying?
I'm just, it's an idea that he has. He threw that out as an idea. I've spoken to him about it very strongly, and we're going to see what happens. We'll take a little bit of a pause. We'll see what happens, but some states are in trouble. I spoke today. I was with a wonderful man, a great gentleman, a wonderful human being. I think Bill knows him too, from New Jersey, Governor Phil Murphy. And we talked about it. You know, New Jersey is it's a wonderful state, I have to say. It's a wonderful place, but it's got a lot of difficulty in terms of the economics and the debt, the costs, et cetera. So it's in a different position than some of the other states that we could mention. We could mention them all day long.
Let me ask you about masks, if I could. Vice President Pence did not wear one when he visited the Mayo Clinic earlier this week. He's wearing one today. You are traveling to Arizona. Will you wear a mask? What is the policy for you?
Well, I'm going to have to
President?
see. I am going to Arizona. I look forward to that. I'll have to see the climate. I mean, I'm going to look at, see, you know, where I am. Here's a place that we all feel very comfortable. Everybody's spread out. It's a very big room. But as far as where I'm going in Arizona, I'm going to have to look at the climate. I'd have no problem wearing a mask. I don't know. I'm supposed to make a speech. I just don't know. Should I speak in a mask? You're going to have to tell me if that's politically correct. I don't know. If it is, I'll speak in a mask. But I'm going to be making a speech in Arizona. I look forward to it. And depending on the conditions, I would have no problem wearing a mask. We have millions of masks now. You know, we have masks coming in that it was another thing. I mean, it was very hard to get masks. We now have, and we're making millions and millions of masks. They're opening plants, and it's been incredible.
Change your position because
The chairman of the Federal Reserve has said that the economic recovery is going to be long and slow. You have said that it's going to bounce back quickly. What do you know that he doesn't know?
Well, I didn't hear what he said. I can only tell you that I see it. I think it's going to be a transition quarter, the third quarter. I think the fourth quarter is going to be very good, and I think next year is going to be fantastic because of the stimulus. And I haven't seen a statement, but I think we're going to have a great year next year. Knowing that we left behind a year of tremendous death. It was just a terrible thing, the likes of which we haven't seen. I guess if you go back over 100 years, 1917.
He's referring to the flu of 1918.
Depending on your account or the account, anywhere from 50 to 100 million people died.
The CDC puts it closer to 50.
100 years. And so understanding that that was terrible, I think that next year from an economic standpoint, I mean, look at the stock market. People are amazed. The stock market's at over 24,000. Well, it was at 29,000. It's 24,000 now. Is that even possible considering what we've gone through?
Stocks have rebounded some, but the Dow just closed its worst quarter in 124 years. It seems far overly ambitious to suggest that the fourth quarter will be strong. Economists at Northwestern, Stanford, University of Chicago, and BU predict that the economy will shrink by 11% by the end of the year.
Really become, the dollar is king, and the dollar's at a position now. It's just a very powerful thing, the dollar. Other currencies are in big trouble. They're really in big...
Actually, the dollar has been slipping against the euro, perhaps in part because the United States has more than 30% of all the world's cases of coronavirus and nearly 30% of the deaths.
Yeah, Jim.
Back to what John was asking about the possibility that this virus came out of a lab in China. Are you insisting, or would you insist on China allowing U.S. investigators into that lab to make sure?
I don't want to go into that. We're going to see. So far, I think China's been trying to be, or at least they seem to be trying to be somewhat transparent with us, but we're going to find out. You'll be learning in the not-too-distant future. But it's a terrible thing that happened. Whether they made a mistake or whether it started off as a mistake and then they made another one, or did somebody do something on purpose, say, hey.
This seems to be a baseless conspiracy theory that the president is putting forward. Medical experts have said that the DNA of this virus suggests that it is naturally occurring, not manufactured. The president has repeatedly in this briefing suggested that it was manufactured. That is, in fact, the plot of the Stephen King novel, The Stand. That also involved a supernatural, evil, dark man taking over the world. Perhaps President Trump will suggest that that is happening as well.
Because you were concerned about the trade
Well, I'm
deal?
making a trade deal with China. This was before the virus. Of course they're going to be complimentary. Now, it was very uncomplimentary prior to that negotiation. And then every once in a while, the negotiation would break down because I'm not like Kerry, who signed the worst deal, the Iran deal, which was such a disaster.
It was not. The general consensus of diplomatic experts is that the Iran deal was working and that Iran is now closer to having a nuclear weapon because of President Trump pulling out of it. I also want to say that just today, the Office of the Director of National Intelligence, which is, there is no full-time person in the position because President Trump fired the last one, but the office put out the report that the intelligence community concurs with the wide scientific consensus that the COVID-19 virus was not man-made or genetically modified. The intelligence community will continue to rigorously examine emerging information and intelligence to determine whether the outbreak began through contact with infected animals or if it was the result of an accident. But again, they have said that it was not man-made. So that is President Trump's briefing for today. Secretary Azar is celebrating the pen that he has been handed, I see. We see that White House advisor Kellyanne Conway is there in the room. She recently suggested that the COVID-19 was the 19th in a series of COVIDs. That's not the case. It was in fact called that because it originated in 2019. President Trump today said that he said in this briefing that no one feels the loss of the 61,000 Americans who've died more pointedly than he does. He says it is what keeps him up at night. To anyone who questions his sincerity, I would point your attention to his Twitter feed. 3 hours ago, he was tweeting about his poll numbers. Earlier today, he was tweeting about Jim Comey. 7 hours ago, he was tweeting about the fake news, the radical left, and the do-nothing Democrats, and predicted that they were trying to steal the election. He's been tweeting about Michael Flynn. I'm just scrolling back. I'm trying to find an instance of him expressing sympathy, sadness, grief for what is happening in this country. Let's see. No. More on Michael Flynn. He tweeted about his impeachment. He tweeted the do-nothing Democrats. Let's see. There's got to be something here expressing sympathy, expressing, let's see. Here's an attack on Joe Biden, a comment about Russia, tweets about Brett Kavanaugh, an attack on CNN, more about Michael Flynn, Lion Brian Williams of MSNBC, another tweet about Lion Brian Williams, an attack on Don Lemon, calling Joe Scarborough another of the low IQ individuals, a tweet about fake news. CNN doesn't want to speak about the persecution of General Michael Flynn. Dirty cop James Comey. His poll numbers, the economy is strong, then something more attacking Democrats, Don Jr. Attacking the Russia investigation, a tweet about Comey, let's see, something else about attacking the FBI. I'm sorry, I'm scrolling through I want to close today's briefing with a statement from the president expressing his sympathy, his anguish over the 61,000 Americans who've died. I'm sure there is something of that nature in his Twitter feed since he's been on Twitter all day, tweeting more about Michael Flynn, more in another attack on Democrats, Hillary Clinton's emails, Comey. All right, I'm going back. There are a lot of tweets. There's got to be something in here expressing condolences for the American people. Let's see, Michael Flynn. Fake polling, just like in 2016. Michael Flynn, defense of Roger Stone. Another tweet about Lion Brian Williams. Another tweet about Lion Brian Williams. Another tweet about Lion Brian Williams. Fake news, CNN. CNN doesn't want to speak out about their, let's see, another tweet about Michael Flynn. Another Michael Flynn tweet. Another Michael Flynn tweet. Let's see, new documents about Michael Flynn. I'm scrolling back. There's got to be something. There's got to be something. All right. Well, that is all the tweets in the past 24 hours. I did not find anything expressing sadness, expressing anguish, empathy for the 61,000 Americans who have died from this pandemic. So it is hard to believe when the president says that that is the issue that is keeping him up late at night. He is, in fact, up late at night, but that is not the issue that he seems to be focused on when he is up late at night. So folks were asking about the timeline yesterday, so let's just go through it again, try to be a little bit rapid fire on it. 2014, President Obama creates the Global Health Security Unit within the National Security Council and creates a 69-page pandemic response playbook. President Trump fires the Global Health Security Unit and disregards the pandemic response playbook. In his first 3 years in office, President Trump ignores calls from the Pentagon to replenish the medical supplies in our National Strategic Reserve. In November come the first intelligence warnings about a dangerous virus emerging in China. In December, the National Security Council is briefed on this danger. In January and February, the Washington Post has revealed that President Trump was warned in more than a dozen times in his presidential daily briefings. January 8th, the CDC issues its first warning. January 9th, the World Health Organization issues a warning, and President Trump holds a rally. January 10th, the World Health Organization issued a comprehensive package of technical guidance with advice to all countries for how to detect, test, and manage potential cases. January 14th, President Trump holds a rally. January 18th, Secretary Azar tries to have an urgent call with the president about the crisis, but the president shuts him down and goes golfing. January 19th, he goes golfing again. January 20th, South Korea and the United States on January 20th each have their first case of the coronavirus. South Korea responds by implementing a widespread testing plan within the first 2 weeks. The U.S. does not create a widespread testing plan even by the end of April. January 20th, when asked whether he was worried, he said, "No, not at all. We have it under control. It's one person coming in from China. It's going to be just fine." January 23rd, China shuts down all of Wuhan. The World Health Organization holds an international news conference. Senate Minority Leader Chuck Schumer calls for a public health emergency. President Trump does not declare one. January 27th, Joe Biden wrote an op-ed warning that the Trump administration was not taking this threat seriously enough. January 28th, Elizabeth Warren released her plan for tackling the coronavirus, and President Trump held a rally. January 29th, Peter Navarro writes an urgent memo warning that millions of Americans' lives were imperiled. Only then does President Trump form a task force. January 30th, China locked down all of Hubei, and that day the World Health Organization declared a global health emergency, and President Trump went and held a rally. We know that in January, the Department of Health and Human Services under Alex Azar requested $136 million to fight the virus, and the White House refused. On February 1st, Trump went golfing. Only on February 2nd did a partial travel restriction on China go into effect. 38 countries had travel restrictions on China earlier or at the same time, and they had more complete restrictions. He's falsely claimed that everyone else was against it, but the decision was made in accord with advisement from public health officials. At least 430,000 people arrived in the U.S. from China since January 1st, including nearly 40,000 in the 2 months after President Trump's fairly loose restrictions. Jennifer Nuzzo, an epidemiologist at Johns Hopkins, says, quote, "We have not seen any evidence that shows the travel restrictions stopped or slowed transmission of the virus that caused COVID-19. February 3rd, the World Health Organization issued a strategic preparedness and response plan to help protect states with weaker health systems. On February 5th, Secretary Azar asked for more money. He asked for $1 billion to fight the virus, and the Washington Post reports that this led to a shouting match in the White House. On February 6th, the World Health Organization began distributing 250,000 tests around the world. The United States refused these tests, saying we'd go it alone. The CDC around that time produced only a total of 90 tests, which turned out to be faulty. On President Trump, on February 10th, President Trump proposed a budget that would cut the CDC by 16%. Also on February 10th, he said that this goes away in April with the heat. Today is the last day of April. Far from having gone away, there are over 1 million cases in the U.S., and it has killed more than 61 million. It has killed more than 61 100,000 Americans. February 15th, President Trump went golfing. February 19th, he held a rally. February 20th, he fired his Director of National Intelligence, who had reportedly been trying to alert him to this threat. He did so reportedly because the office of the DNI had alerted members of Congress that Russia was still working to meddle in U.S. politics on Trump's behalf. That night, President Trump held a rally. On February 21st, Trump rallied. On February 23rd, Peter Navarro sent an even more urgent memo. Only on February 24th did Trump finally ask Congress for additional funding. On February 26th, he tweeted, "You treat this like the flu. The risk to the American people remains low. The 15 cases in the U.S. within a couple of days is going to be down close to zero." There were 60 cases actually in the U.S. at that time. There are now, as I've said, over 1 million. February 27th, he said, like a miracle, it's going to disappear. February 28th, he held the rally where he called it, quote, their new hoax. The very next day was the first reported death of an American to the virus. Washington State declared a state of emergency. March 3rd, he said things are going very well. And he said that he didn't think that it would spread across the country. March 4th, he said in an interview with Fox News that it might be fine for people to go to work with it. March 5th, California and Maryland declared states of emergency. March 6th, Kentucky and Utah declared states of emergency. He went to visit the CDC wearing a campaign hat and said, I think we're doing a really good job in this country at keeping it down. Anybody, right now and yesterday, anybody that needs a test gets a test. They're there, and the tests are beautiful. The tests are all perfect, like the letter was perfect. The transcription was perfect, right? It was not true then that anyone who wanted a test could get it, and it is still not true now. The next day, New York declared a state of emergency, and Trump went golfing. March 8th, he went golfing again. March 9th, he compared it to the flu in a tweet and suggested it would go away on its own. March 10th, he said, it's really working out, it will go away. March 11th, there were about 26 deaths reported in a retirement home in Washington. The World Health Organization upped the ferocity of its language and declared it a pandemic. Only on March 13th did Trump finally declare a national emergency. On March 16th, in a call with governors, he said, respirators, ventilators, all of the equipment, try getting it yourselves. Only on March 16th did he finally put out national guidelines for social distancing. March 17th, he said, this is a pandemic. I felt it was a pandemic long before it was called a pandemic, a reminder that just days before he was still comparing it to the flu. On March 26th, America surpassed the rest of the world for the number of cases. All through March, governors begged him to invoke the Defense Production Act. He did not formally invoke it until the end of March. On March 29th, after 3 months of downplaying the threat of the virus, he finally acknowledged that the death toll in the U.S. could be up to 200,000. And moments later, he bragged about the ratings of his briefings, comparing them to Monday Night Football or The Bachelor finale. We have to date lost over 61,000 Americans to this virus. That is more than we lost in over a decade of the Vietnam War. And the Institute for Health Metrics and Evaluation says that 90% of the projected deaths could have been prevented if the president had taken action just 2 weeks earlier. He had the opportunity to take action months earlier. He says that what keeps him up at night is the loss of American lives. But as I said moments ago, it appears that what keeps him up at night is tweeting about the fake news, Democrats, the Russia investigation, and Hillary Clinton's emails. We'll leave it to you to judge the sincerity of his feelings of empathy that he says that he has for the Americans who've lost their lives. Thank you for joining us today. I am NowThis senior politics producer, Alan Piper. I had the support of our full team today, each working from their respective homes, including Emily Barger, Maddie Green, Kafish Harjai, Megan Hirschlein, Michael Lester, Ian McKenna, Brandon Caruso, and Shelby Vacquelin. To everyone out there, please stay safe. Take care of yourself. If the president is back tomorrow, our team will be back to fact check him as well. Thank you, and good night.